Hello, my name is Kelly Maston, Coalition Manager at NASHBIT, and I would like to welcome you to today's SAMHSA-sponsored webinar titled Assuring a Child Welfare Competent Mental Health Workforce, an overview of the National Adoption Competency Mental Health Training. Today's presentation will be recorded, and the recording link, slides, and a certificate of attendance will be sent via email to everyone who attended today. The recording can also be found on NASHBIT's YouTube channel and website. Closed captioning can be viewed by clicking the CC at the bottom of your screen or clicking the link in the chat pod to view in a separate window. We also have an ASL interpreter who is spotlit on your screen. When the presentation ends, a brief survey will show in your browser. Please take a few moments to share your thoughts about today's presentation. Thank you again for joining us, and I will now turn this over to Edna Davis-Brown.
Wonderful. Thank you. Thank you so much for that introduction. I want to say hello to everyone and welcome to today's webinar entitled Assuring a Child Welfare Competent Mental Health Workforce, an overview of the National Adoption Competency Mental Health Training Initiative. What a mouthful. We're just going to say NTI moving forward. Just a little bit about me, and then my co-presenter, the lovely Lisa Maynard, will share information about herself. I am a training and implementation specialist with the Center for Adoption Support and Education. We're based out of Burtonsville, Maryland, and I work out of my home here in Silver Spring. My background, I have a master's in public health education, originally from North Carolina, but I've worked a lot in training and technical assistance delivery and a whole area of health-related topics. And I'm just happy to be here to represent child welfare in terms of training and technical assistance. So Lisa, you want to share a little bit about yourself?
Sure. Hi, everybody. Thanks for being here today. I'm Lisa Maynard. I am the esteemed colleague of my Edna Davis-Brown. We are doing trainings all over the country, and I'm pleased to be here today. I'm a training and implementation specialist as well, and I've been working in child welfare and in adoption since adopting my children, who are now almost 37 and 33, so a very long time. Really happy to be here and share this training with you all, and really trying to increase the competency of our workforce across the country.
Great. Thank you, Lisa. And as we're about to transition to the next slide, I want you to do a couple of things. Put your name, your organization, and role in the chat box. We're going to be using the chat box quite a bit, but I also want you to put in what brings you joy. What really brings you joy? And I can share with me, my walks in Rock Creek Park at least 4 days a week really brings me joy. So I love being outside and being in nature. So if you can share that with us. Of course, today we're going to be providing an overview of this free, did I say free? Web-based National Adoption Competency Mental Health Training Initiative, NTI, for child welfare and mental health professionals. And I see folks putting stuff in the chat. Keep it coming. Your name.
So my baby, my dog, my husband, my partner, kids and pets. Everybody loves kids and pets, right? My babies. Oh, Chris says time on the lake, helping others. Sunshine. I'm in upstate New York, and right now it is snowing. We haven't had snow in over a month, and today here in mid-March it's snowing. Let's see, my dogs. So yeah, lots of sunshine, beach, family. Well, not a surprise for folks who are working in this field to be really have joy with family, right? Oops, sorry
Yes.
about that.
That's okay. Wonderful. Just keep it coming. And I see people are from all over the country and are in various roles. So thank you. Thank you for acquiescing and putting that in the chat. We'll be doing more in the chat as we move forward. So next slide, Lisa. So let's talk just a little bit about for the Center for Adoption Support and Education case. We provide adoption competent counseling and educational services to families in Maryland, Northern Virginia, Washington, D.C. And we really envision the work that we do in that everyone touched by foster care and adoption has access to the adoption competent support necessary to navigate this lifelong journey. For NTI, we're funded through a cooperative agreement with the Children's Bureau, and we build on the firm foundation and core values of CASE. So you'll see some of the services and supports we do. We have several national projects which we'll reference later on, but we are true to form in clinical services. Now, let's talk a little bit about NTI. Basically, when we talk about child welfare and mental health professionals serving these adoption, guardianship, foster families, they often need additional training to enhance their understanding of the real complex issues, including trauma, attachment, grief and loss, identity formation, etc., that can complicate or contribute to social, emotional development and stability. NTI is a web-based, self-paced, free training designed to improve collaboration between service systems, leading to what we believe is real practice change and improve child and family outcomes. NTI delivers skills, strategies, a shared language designed to really address the unique challenges that families face. It's been shown to improve casework and clinical practice by infusing permanency, adoption, and mental health competency in child welfare and mental health organizations across the country. And Lisa is putting the links in there about the training as well, and there's additional information. Now, I want more input from you. I want you to look at this picture and tell me what you see. Put it in the chat box. What are you seeing in this picture? What feelings come up from you? What observations? Write them in the chat. Write your observations.
Chaos.
That's always the first word, chaos.
Anxiety, poor mama. Yeah, anxiety. She seems to be depressed. Oh, and somebody says life, contentment, peace.
Ooh, I love that.
Maybe she's like, she's looking peaceful. Chris thinks she's looking peaceful in the center of that.
Yes, playing fun. Happy kids,
Yeah.
but a stressed mom, huh?
Seems like a lot to handle, right?
Yeah. You know, it's funny. I come from a background also of working in HIV/AIDS, and we talk a lot about the strength-based approach, and probably in your work you do that as well. And we ask about this picture because oftentimes what we get is sort of negative feedback or feedback that's maybe not as positive, but that's not the case with this group. We're hearing some real positive feedback. And what we often ask about is, now that you probably brought up some things that might be perceived as negative, what do you see as positive? And I heard those things. Family, of course, there's some anxiety. And oftentimes some people say to me, that mother looks really cool. I wonder what's in her cup, so to speak. And, you know, it's a lot going on, but also some other things that come up is that it looks pretty chilly outside, right? You see the snow and the mountains. Obviously they have heat, right? And there's food and there's things for the kids to play with. You know, even though there's paint and everything all over the place, mom does seem cool unless she's just, you know, zoned out or something. So we often in our work want to try, even though in the midst of all of the things that's going on with these families, we also want to find the positive things, the things that we can really support and build on as well. So I often show this to reiterate too, how important the strength-based approach is in our work and looking for the good things in life as well. So
A lot of
thank you.
people did. Somebody else mentioned a car in the driveway. So there's a lot of positives, even though like this chaos would make me crazy, right, Edna?
Right. Yes, absolutely, absolutely. So thank you again for your participation and your observations. So because of traumatic life experiences and some compromised beginnings, many children in foster, adoptive, or guardianship families experience elevated risk for developmental, health, emotional, and behavioral challenges. The impact of these experiences compromise family stability and well-being and stress the systems that work and support them. So for most children, adoption in and of itself is a protective factor despite everything for most children. So we want to reiterate that. The American Academy of Pediatrics estimates that up to 80% of children and adolescents enter the system with a significant mental health need compared to maybe 18 to 22% of the general population. So there are significant health needs, mental health needs. So it makes sense considering that they entered the system due to abuse, neglect, trauma, etc. Next slide. So as we move forward, as we talk about our training, as we talk about the issues, we want to reiterate that because of these statistics and our own professional experiences, the NTI trainings are based upon guiding principles, which we believe are critical to supporting children and youth in foster, adoptive, kinship, and guardianship families. So Lisa, let's now go into detail about some of those guiding principles.
Okay, unmute. So we're going to start with loss. First of all, loss is at the heart of every single adoption, every guardianship situation, right? Children have to lose something in order to come into care. Even if it's there's been some real hardships, if there's been a lot of trauma, again, as Edna mentioned, abuse and neglect, there still is that feeling of loss for the child or the youth. Oftentimes we focus on the gains in adoption. For example, we find a family for a child or a youth, or we fill the void for infertile couples. We feel good about that without acknowledging those inherent losses for the child. Also for the adoptive family, the guardianship family, and the birth family as well. So everyone in that adoption constellation, if you will, or the adoption kinship network, as it sometimes is called, everyone in that constellation experiences loss to some degree. The intensity of grief related to adoption loss is often difficult for those outside of our realm to understand. And if the sadness is not addressed, we often find there's alternative expressions of anger or rage, right? If they can't get those feelings of loss out, if they're not recognized, that gets internalized and then can explode. So why is loss and acknowledging that loss important? What are some of the losses you can think of in adoption and foster care and guardianship? You can put your answers in the chat and we'll take a quick look at those. What do you think is going on? Genealogy, where we came from, right? Where I came from is really important to a lot of people. Oftentimes I hear adoptees say that they feel like they were dropped on the planet from outer space. Who do I look like? What's normal, right? All my friends are with their mom who gave birth to them. So that loss of what's normal. Yeah. Yeah, so a lot of aspects of loss here. For the parents who lose their children through involuntary termination, they've lost the right to parent their child, right? I see the attachment bond, yes, for sure. So a lot of losses going on, access to traditions, culture, practices, that disconnection from their biological family, their biological connections. So yeah, a lot of loss going on. For the parents who are adoptive parents or guardianship parents, sometimes it is the loss of that connection for them to a biological child, a child they gave birth to. So not having that biology feels like a loss. Not parenting a child who was born to me might feel like I missed out on something. I hear that from adoptive parents sometimes. For the grandparents who are doing guardianship, kinship placements, parenting their grandchildren, they can have a feeling of loss of where my life was supposed to be going. What was I planning to do? And now I'm parenting little ones again. So lots of loss going on there. Two aspects of adoption loss that make it even more difficult to resolve are the nature of ambiguous loss and disenfranchised grief. For those that the child has, for whom the child has lost that are likely to be living, it makes it hard to really accept that finality of that loss. There's somebody there and I know it, and I just can't reach them. Out of reach, but still there. And additionally, the adopted person's grief is not typically acknowledged or supported by others. This disenfranchised grief is misunderstood and often not honored, as we do when we lose somebody to death, right? There are lots of rituals connected to the death of a loved one that just don't happen in adoption, in foster care, in guardianship, and kinship placements. It can lead to feelings of isolation, sadness, depression. Often therapists and our families and friends don't understand how this ambiguous loss and disenfranchised grief affect the children and parents that we're working with. Another one of our guiding principles is attachments can be built and rebuilt, even for those with serious emotional disturbance. Attachment is difficult for children and youth with compromised beginnings. When attachments are broken and broken repeatedly, oftentimes. Last week I was doing a consultation for one of our cohorts, and they presented a case of a 9-year-old child who had been in 27 placements. 27, right? And what's this little guy's, this 9-year-old's diagnosis? Reactive attachment disorder. And, I want to say, well, no kidding. This child can't attach because he's had nobody to attach to. There has not been a stable attachment figure in his life. So what do we expect, right? A child who has experienced poor nurture and impaired attachments can build new and secure attachments when proper therapeutic work is done by the parents and often with the help of adoption competent mental health professionals. We have to understand that those losses, that those breaks in attachment matter. They're meaningful. They impact the ability to attach, but it doesn't mean the child can't or will never. So it's important for mental health professionals to hold the belief that there is potential for resiliency, there's potential for healing, and that together with parents, the children can have hope and strive for positive outcomes. Another of our guiding principles is race impacts identity and adjustment and serious emotional disturbance. So race, ethnicity, culture, class, sexual orientation, gender identity, and formation and expression all have a unique role in our work and in positive identity formation. Mental health practitioners must develop an awareness of how these factors impact placement decisions, treatment plans, how we work with kiddos and families. We need to be aware of that historical trauma and experience of discrimination. Racial identity, self-esteem, identity formation, all are affected by attitudes and behaviors as much as those of the families and communities in which they live. We also have to be able to have skilled conversations about these difficult topics, right? Race is not an easy thing to talk about. Sexual identity, gender identity, identity formation in general, these are not easy topics in general for families to discuss. And oftentimes therapists feel like they're ill-equipped to talk about it as well. Topics of racism and sexual orientation are just not comfortable for most people. So we have to learn how to do that. We have to practice how to do that. When children have different race or ethnicity, culture, or sexual orientation from their parents, it's critical for parents to honor these aspects of the child's identity and provide socialization experiences that facilitate that felt sense of safety and well-being. It's really, really important. Without the ability to talk about it, we're not going to be able to have a healthy identity development in children. Not easy topics, right? Who wants to talk about sex? Who wants to talk about racism? Oh my goodness. We'd rather it just be in the background and hopefully, kind of goes away. But that's not the case. Just not the case. Another one of our guiding principles is trauma changes the brain. Trauma changes the brain. It reinforces the synapses of fight, flight, or freeze response. And then what do we see? What happens when those responses are activated? We see acting out behaviors. We see rage. We see dissociation. We see isolation, diminished felt safety, and a sense of personal control. That ability to regulate, self-regulate, really is quite diminished. When I'm feeling like I am threatened, man, I'm just going to be in that state, fight, flight, or freeze. And depending on, what the danger is, right? If it's, if I see a snake in the grass, right? Well, then I just might run because I know I could get away. But if it's somebody who's looking to assault me, then my response may be different. It's very scary, but it's a response that manages our ability to survive, right? These are normal responses to abnormal situations. We need to be paying attention to those. So yeah, adoption is complicated. As Edna said earlier, it's a significant protective factor in many, many cases, but it is very complicated. As an adoptive parent, I have certainly understood that from my kids' perspective in a way that I didn't before I adopted, right? I just wanted to be a mom. I didn't think that there was going to be any big deal, and that my children were adopted from another country. They're Korean born, so they don't look like us. And it's, it's out there for everybody to see, right? So it's more complex than I ever imagined, and it really is more complex than a lot of people understand. On finalization, a judge will often say to families, I've heard this over and over again in all these years I've been doing the work, now this child is as if they were born to you. They're your own. Love and parent this child as if they are your own, because they are. That's the expectation, but it's different. It's complicated. Parenting a child who's come from tough beginnings is different from parenting a child that was born to you. When there's that security and that nature and that exchange of all that good juicy stuff that happens when a child is born and stays with their birth family. Research tells us that many adoptive and guardianship families don't feel they're getting the help and understanding that they need. I've heard this over and over again in the 30+ years I've been doing this work. Oftentimes I hear from a parent that the therapist that they were working with told them, well, this isn't what you expected, so maybe you should just give this child back. Well, that's not so helpful, is it? That's not so hopeful. And what does that do to a child who's been traumatized and who's had difficulty attaching, right? It just exacerbates all those things. There's often a great lag between the adoption, the pre-adoption training, and the placement. And oftentimes parents just don't have the tools that they need in order to do a good job of parenting, to be effective. Oftentimes they don't have all the information, the child's history, right? So they oftentimes spend time educating the therapist. Here's what I know about adoption, if you don't know anything, and can we figure this out together? It can be really frustrating for families. So what are some of the needs that you see in your community with the families that you're working with, or the families that your agencies are serving? Chat box. I'm seeing a lot of chats in here. Yeah, thank you. It's an error to sever the child from early relationships, keeping a flame alive in order to address future needs. Yeah, like that, right? Keeping them connected to their birth family. Brittany says, when I aged out of the system, I had 21. At 21, I had been in 97 placements. Oh my gosh, Brittany. Oh, that's just heartbreaking. And I'm so sorry. The system so failed you. I'm so sorry. And I'm so happy that you're here today. Thank you for being with us. So yeah, the families are saying there's a lack of adoption competent therapists, a lack of trauma-informed resources. Do parents have realistic expectations? Oftentimes they don't. I'm working with a family of a small private practice here in upstate New York. An older couple who are parenting for the first time. They adopted two teenagers who have a pretty significant trauma history. And they were hoping that adopting two traumatized kiddos is going to save their marriage, right? That's an unrealistic expectation, right? Yeah. Yeah. Trauma training for adoptive parents, for sure. Sure. So what is the impact of growing up in an orphanage, growing up in institutional care, right? I look at this picture and again, I get a little bit heartbroken. All these beds close together. What do you think the individual care is? What do you think the attachment work is going on here? Their faces, they look, they look sad and kind of lonely to me.
And
Does it
Lisa,
feel like-
one person, I'm sorry to interrupt.
Go ahead.
Schools that don't understand the changes that adoption brings for children and families. So I'm glad to hear about schools as well.
Yes, thank you for bringing that up. And we also have, we're not really talking too much about it today, but we do have an NTI version for school-based mental health professionals. And again, it's free and it's available to school systems around the country. And we think that that's a real important piece as well. Let's see, Brittany says, one thing we really need is foster parents to understand that we are not used cars. You can't just trade us in when things get rough or you're bored with us. Yeah, for sure. I mean, really, we owe it to our children to stick, hang in there, to stick in it when times are really tough. Parenting is not easy, not for anybody. And parenting children who've been moved around multiple times, holy cow. I can't even imagine 97 times. I've lived in upstate New York in the same city for my entire life. I can't imagine in 3 different houses in my whole life. And I'm, well past a teenager. And so the idea of moving and being moved, right? Not my choice, but being moved by somebody else to some other place to be with strangers. Yeah, really, really, really hard. So yeah, I appreciate that we have somebody on who is really willing to share so personally. Thank you so much, Brittany. Yeah. So what are families telling us they need? It's really the basis for the work that we're doing with NTI. Families are telling us repeatedly they need access to services that meet the needs of their children and family. I need somebody to work with my family who gets adoption, who gets loss, who really believes in me and believes that my family and our parenting will make a difference in the child, that attachments can be built and rebuilt. And not to just sort of wash their hands and say, wow, that's really hard. Maybe you should just move on, right? We just need families. Families need professionals who get it. When mental health professionals don't have that competency, they often do more harm than good. And we see that in the multiple moves and the families who don't believe that they can make a difference. We hear from parents that and children and the youth that we're working with across the country, they don't want to be blamed for things for which they're not responsible. You're telling me I've got attachment disorder? You're the one that moved me 27 times. This is not my fault. The parents who are not getting the support that they need, it's not their fault. Their child's bad behavior, right? Their child's acting out behavior because of their loss, because of their grief, because of their feeling like they don't have a place, they don't belong. They're not seen and heard. It's not their fault. And we need professionals who understand that. Shame and blame often lead to feelings of hopelessness, helplessness, anger, rage. I'd be mad. I sure would be mad. So now let's talk about some of the tools and strategies as we look through the lens of adoption.
Yes, thank you so much. And I want to thank all of you for engaging and providing your thoughts, your feedback, your experiences. We are so thankful for that. Let's talk about the lens of adoption. NTI, this free, robust training that we're really basing this presentation on, really provides the lens through which to see and address the mental health needs of kiddos and adoption and families and adoption, foster, and guardianship situations. So let's really take a deeper look in that lens. So it's important that professionals have a greater understanding of these core issues that show up throughout the life cycle. There are psychological themes, as well as the normal developmental challenges that kiddos face. We also have the impact of the child's past experiences and those impacts that are really resonating with current and future relationships, and even how they'll be as potential parents. We have parents coping with infertility and other losses, which really can be triggered by feelings of being overwhelmed or loss of control. There's child's pregnancy and even subsequent losses. And then, of course, there's always the differences in race and culture and SOGI. So there's so many issues that really span the lifetime, so to speak, the whole entire cycle. So, Lisa, we're going to talk about some tools and strategies when we need mental health professionals who can give families and tools that they need to parent successfully. So we're going to, following this slide, we're going to really start looking at some tools and strategies to address those core issues of loss, grief, and attachment, those things that Lisa talked about earlier. So I want to take you guys through an exercise, and you may have had or engaged in this before. We're going to try this exercise from NTI's module on the impact of loss and grief on children's mental health. You may have seen this before in another training, but what I'd like for you to do is take out a pen and a piece of paper. So I want to imagine, for you to imagine, You're having a final afternoon. You're sitting in your favorite spot, reading or watching TV, sipping on tea. You're nice and relaxed and chilled. And suddenly there's a knock on your door. And when you open it, a stranger tells you that you are moving and you have 10 minutes to pack 10 items to take with you. So for this exercise, you can count a person as an item. So I'm going to ask you a question. You only have 10 minutes. You've got 10 items. So on that piece of paper, tell me what 10 items and or people you will choose to take with you to put on this moving vehicle. Write those 10 items down. I want to give you a couple of minutes to think and write those down. 10 items and or people that you will take with you on this moving vehicle. So as you're writing those down, we're going to discuss this in greater detail, but there are some other situations I'm going to share with you before we get there. Hopefully you've gotten close to 10. So, wow. We see that 5 of those 10 items you chose still will not fit. There is no room for anyone else. So I want you to choose to remove 5 items. You can only take 5 items now. Take 5 items off your list. Five items must come off your list. Cross those items off. But oh my goodness, you got to choose again. You can only take yourself and one other person/item. You need to choose again. So you have to cross off 3 items off that list of 5. Remove 3 items, which will leave you and one other person or thing. And Beth says, nope, can't do it. I understand, Beth. It's tough. It's really tough.
Yeah, a lot of people are saying they can't do it.
Yeah. Yep, absolutely. A lot of folks were experiencing the same thing. Let's go to the next slide, Lisa. So let's process this a little bit. And some of you have already expressed your feelings about this exercise. Put in the chat, what are you feeling right now? What are you feeling? How did this exercise make you feel? And think of it in the context of kids who have moved multiple times, who have had probably that big, black trash bag of items that they're moving with them.
I see,
And
not doing it.
Not doing it. Stressed.
Stressful.
Yeah. Disrespected, stressed. Yeah.
I want to cry. Yeah, Gayla, for sure.
Yeah.
Horrible and lonely. Angry.
Yes, a whole mirage of feelings. Empathy as well. My
Having to
niece.
choose between my partner and my cat is horrible.
Ooh, yes, yes. So tell me, guys, anyone can just share in the chat. What did you give up? What did you give up? Can anyone share what you gave up?
Terrified, minimized, angry, forgotten. These
Everything
are
but my
great. Thank
dog.
you.
Too much, overwhelmed. Absolutely. Stressful. Absolutely. What did you take? What did you decide to take with you. All my items were family, my kids. Yeah, it's a difficult choice. And if you can only take one other item or person, my goodness. So within the context of a foster or adoptive kid, think about all the things that they leave behind, the people, their personal items. It's quite overwhelming. It's a lot of loss, right? And I suggest that you may do this with your staff or someone that you're working with to get their thoughts and feedback about this process. Even a potential foster or adoptive parent. Someone says, reminds me of Sophie's Choice. Yes, absolutely. Really tough. Brings up a lot of emotions and feelings.
So in this exercise, we let people take their people with them.
Ah.
What happens with
Wow.
our kiddos when we move them?
Yeah. Yeah. Wow. There's a lot. There's a lot. Yeah.
They're not able to take children, and people. They're people, they're not able to take pets. Right? Oftentimes they don't really get much of a choice about what they are able to take.
Yeah. Yes, Eileen, they develop the need to detach. Absolutely. Absolutely. So there's a lot of learnings and aha moments from this exercise. And what we've heard and my own experience as well was that this exercise, which is only an exercise, not real, it's still really hard. And it sort of provokes real strong feelings. Great sense of loss. Lots of responses and reactions. I want to thank you guys for really engaging in this exercise. And I encourage you to use it as well with staff and with others to see what kinds of feelings, emotions, reactions come from it. So Lisa, let's move to another activity, storyboarding. And if there are others who may have heard of this, raise your, give me a thumbs up in your chat. It's one way of helping a child tell the story of their life from their perspective, so to speak. It helps facilitate understanding and healing and allows them to integrate their history into the present. Have the kids that you're working with to create their story. Have them to create it. No need to correct it. First, let them share, and then later you may have the opportunity to insert some facts if you know those kids personally or have been working with them. So it's like different segments of their life, a story, building one sort of session or piece, segment builds upon the other, right? So it is a story that can be added to, can be shared, can sometimes really evoke lots of emotions. So storyboarding is definitely one way of having kiddos tell their life's story. So Lisa, let's touch a little bit on trauma and how it impacts attachment.
Okay. I am going to, I also want to say that this is a great tool to use to help a child understand their own story. When they tell it to us as a worker or as a therapist or as a parent, and helping them to integrate their whole history into the present time. So it can be a really useful tool. And there are a lot of resources, a lot of ways to do this. This is just one, just a real easy example. So let's talk about trauma and attachment. So we know that adoption is a powerful human experience, right? It can be therapeutic, it can be healing, but it touches on universal themes of creating life, abandonment, loss, we've talked about, personal identity, and a sense of belonging. And when we're broken apart from our family of origin and brought together, it can be, as we had said earlier, it can be a healing experience, but it's also traumatic. Traumatic experiences can initiate strong emotions and physical reactions that can persist long after the event happens. Children may feel terror, helplessness, fear, as well as physiological reactions, right? The reactions that we get when we're feeling traumatized. Our hearts beat fast, we get sweaty, maybe feel like we're sick to our stomach, or a headache, tension. Kiddos can get that loss of bowel or bladder control as well. Children who have experienced an inability to protect themselves or who lacked protection from their significant caregiver, their primary caregiver, the protection from others, they might also feel overwhelmed by the intensity of everyday physical and emotional responses. It triggers feeling, right? Getting excited may trigger that feeling of fear. It doesn't sort of make sense unless you've already been in that place, right? Their nervous systems are wired for fight, flight, or freeze. They're not so open to feeling comfortable in new situations or attaching to strangers because of their experiences, because of that early trauma, maybe ongoing trauma, the complex trauma. So then we see things like acting out, self-harm, acting out with others, right? We see a lot of perhaps screaming, maybe fighting, maybe substance abuse for our older kiddos. Yeah, so we see all of these things, but we have to really remember and do the work. Attachment takes time. Again, attachments can be built and rebuilt, but it does take a lot of time. I worked with a mom once whose daughter was adopted from China. And when the daughter was about 30 years old, mom came in and said, "Hey, this Thanksgiving, my daughter finally hugged me." She said, "My daughter finally hugged me. It was so big." She didn't give a hug like, the far away hug, but a full on body hug. And mom was so grateful. It took 28 years for her daughter to attach to her, but she did it, right? So there's where that hopefulness is. It's a long time. It's a long time to be a parent without getting that reciprocal juice, all that feeling, but it does happen, right? We just have to be patient. So NTI has a lot of skills and strategies and tools that are built in to help parents better meet the needs of their child and manage those challenging behaviors. That's what usually brings kids and families into therapy, right? It's the challenging behaviors. And so we want to help parents address those behaviors and work on the attachment piece. So we're going to look at a couple of tools that we've got embedded in the NTI that are evidence-based or evidence-informed and that have been shown to work well with these kiddos and families. Okay. So first, we're going to look at collaborative problem solving, or CPS. When I first saw this, I thought, CPS, well, that's not an intervention, that's Child Protective Service. But we're going to look at this as a tool, collaborative problem solving. It was developed as a trauma-informed model of care with the goal of helping youth and parents resolve differences in expectations rather than to modify behavior through application of rewards and punishments, right? Punishments don't really teach anything. It's just kind of it's a control issue for a lot of folks, right? So in CPS, it's based on the premise that challenging behavior occurs when a child lacks the skill, not the will, to behave in certain ways. So CPS focuses on building skills like flexibility, frustration tolerance, problem solving, rather than just trying to motivate a child to do better. CPS addresses behavior and facilitates attachment. So plan A is sort of traditional old style parenting. This is how I was raised. Plan A is you will do as I say. I'm your mom because I said so, right? Adults imposing their will to make a child meet their expectations. Now, sometimes that works with some children and sometimes it doesn't. But it doesn't typically work with children who have a trauma history. Plan A not only causes often more challenging behaviors, right? It doesn't teach the skills that the child lacks in order to have that negotiation, to understand and do what we really want the outcome to be. And worse, Plan A interferes with teaching those skills that get in the way of developing relationships that are really crucial to human development. Even children who have not experienced early trauma have few skills to respond to Plan A adaptively, right? Plan A simply is might makes right. Again, because I said so. And again, sometimes it worked for me, but it's not always the case. Plan C in CPS is when we decide to drop an expectation. Now, this doesn't mean that we're going to never address what was going on. We're not going to address it right now, perhaps. When my daughter was a little girl, maybe 3, 4, 5 years old, she just fought every day about what she was going to wear. Well, I guess I fought every day about what she was going to wear, right? I didn't want her going to preschool in her big brother's oversized ratty old shirts and big shorts that were, 7 sizes too big for her. And we had fight after fight after fight until it finally dawned on me, like, why am I fighting about this, right? Because I don't want to look bad. Why is that mom sending her daughter to school looking like this? So drop it for now and come up with another way of addressing it. What's appropriate dress for school? We're going to talk about that another time. I'm going to get that off my plate right now, right? What is my priority here? My priority is to build connection and not worry about making sure that she dresses the way I want her to. All right. It's putting some problems or unmet expectations on the back burner and just focusing on the things that are the higher priority. What's safe? What's going to help this child feel a sense of belonging, safety, love, right? Adults are still in charge when using Plan C because they're deciding what to address and what to drop for now. So we're not abdicating all responsibility. We're not giving up all control, but letting go and not digging in so deep. And then finally, Plan B is the heart of CPS. It's when adults and children work together to solve problems in a mutually satisfactory way. It involves about 4 basic steps: identify and understand the child's concern about the problem, and reassure them that we're not here to impose our will, but let's work this out together. Identify and share the adult's concerns about the same issue. Okay, kiddo, here's how I see it. And then use the time to brainstorm, what might we do to resolve this problem, you and me together, right? How can we figure this out? And then the last step is agreeing on a solution. Let's figure it out together and let's try it. Let's give it a try, right? It's not always going to work the first time. The solution may not always feel the best to us, to the parents, or to the therapist, but can we give it a try and facilitate some of that attachment work, challenging our child to come up with some solutions themselves? It helps build relationship. It helps build thinking skills. It really creates that intrinsic motivation. I'm going to do it now because I want to, not because you're making me. And that confidence that I am able to make decisions and really have some control. So CPS is a really great intervention and a way of parenting. And we can teach, those of us who are working in mental health can teach parents to use a tool like CPS. Another great intervention is serve and return. So a lot of us do this, to a lot of us, this comes naturally. Seeing what a child is focusing on, where's their attention, and then reacting to it as the adult. So a therapist in the room might see a child walk around the room and pick up different objects. And you can say things like, oh, gee, I see you like that stuffed animal, or you're looking at that child, you're looking at that picture of my puppy, you know, do you like it, right? And that engaging back and forth, name it, return the serve by supporting and encouraging. Give it a name, take turns, right? One example of this is when a child hears a song and they start sort of reacting to a song. And Edna and I have done this, and Edna's got a beautiful singing voice and does the wheels of the bus.
The wheels of the bus go round and round, round and round, round and round. The wheels of the bus go round and round. And you have to say,
all through the town. And so we notice that the child is smiling, is engaged. It's like, oh my gosh, you like that song? That's the wheels of the bus, right? And you know, what does that feel like? Oh, I like that too. It makes me happy. And it goes back and forth. And this interaction, this serve and return, if you will, it helps us to practice beginnings and endings and noticing, right? Being present in the moment. I love that present moment experience for this. This serve and return, we've got a great video, and maybe we could put that in the chat a little later. We don't always like to use videos in presentations because sometimes technology does not cooperate, but we'll make sure that you can get it. So that really builds that solid foundation for a child's brain for future learning and development. It takes two to play. Okay, what are some other things, Edna?
all righty. Thank you, Lisa. Let's go to the next slide. So one of the things that we have embedded in the training is the adult attachment interview. Now, we don't have the format or the way to do this, because usually we would divide you up into 3 groups and have you kind of discuss these 3 questions. But this is actually built into the training. It really gets at your own attachment style, and basically asks 3 questions or 3 things to process, lists objectives or phrases to describe your relationship with your mother and father during childhood, and the question of why do you think your parents behaved as they did during childhood? And the other one was, when you were upset as a child, what did you do? What would happen? Can you give some specific incidents when you were upset emotionally, physically, hurt, etc.? So it really gets at your own attachment style, how you were influenced in terms of your parents, sort of way they responded and how they guided a process, and how you reacted. So again, another piece that we've added to really get at your own attachment style, and maybe how that has influenced your style when interacting with your kids. So next slide. We're talking about attunement and attachment. So we want you to take a look at a photograph. If we can get the next slide, Lisa.
Yes, what happened here?
Oh, it's not moving.
It's not moving. Hang on.
We're stuck. Oh, wow. We have
about technology.
Yeah. We have a lovely photo. Should you go out and come back in, you think? What do you think?
Yep, I'm gonna try that.
Let's try that. As you know, technology at its best sometimes doesn't work. So bear with us as we try to get up a photo we want you to take a peek at. So we're talking about attunement. Tell me what you see in this photo, because we know what happens when early attunement isn't present or is chaotic. I know, Lori. Yeah, technology is great, then it isn't, right? So put in the chat what you're seeing in this photo with this little kiddo and his mom there, distracted. She looks detached. Yeah, want or need. Interesting, Valerie. Kid looks frantic. Yeah, kid, I want your attention, mom. Basic needs aren't being met. He's longing for her attention. Mom disengaged. Kids desperately wants attention. Absolutely, we see that clearly in this picture about the need for attention. That kid wants to attach to his mom, and she's engrossed in that newspaper, whatever's going on. So, when early attunement isn't present, it can certainly have deep, profound effects. It's kind of like my needs aren't being met. And it almost gets to the point where they don't expect their needs to be met, so to speak. There's lots in the chat. Oh my gosh. Richard has some models and things that he's referencing that as well. So early attunement is so important. And when it's chaotic and not present, it can certainly have profound effects. So let's switch up just a little bit, Lisa. So let's talk about ways to encourage attachment. We talk about responding to one's arousal and relaxation cycles, initiating positive reactions, really having some real great reactions, connecting reactions, and of course, claiming behaviors in terms of, yes, oh, you're happy. Yes, let's eat some cotton candy. We want to be able to respond to what we're seeing with our kid. We had, as Lisa was talking, we had a great video where this little kid was yabba dabba doing and saying all these kinds of things. And the parent was doing the same thing. The kid was cooing and they were having this dialogue that nobody really understood in terms of what the kid was saying, but it was just such a great way of encouraging attachment between a father and son. So what ways do you see, or have you seen that parents have used or you've used to encourage attachment with your kiddos? Put those in the chat box. Responding to reactions, eye contact, touch, talk to get, oh yes, love it. Talk, singing and music, oh yes, I love those too. Absolutely. Great ways of encouraging attachment. Any others you want to put on the screen in the chat box would be certainly welcome. So there's so many ways of encouraging attachment, and certainly so many ways that we can reinforce those with the parents that we're working with. Cooking, someone said cooking, yes. I recently cooked some oatmeal raisin kits with a couple of oatmeal raisins cookies with a couple of kids recently. That was so much fun. We had flour all over the kitchen and raisins all over the floor, but what fun. And they turned out great too. Wonderful. So we know about ways that we can truly encourage attachment. Crafting and gaming together, wonderful. So we can truly make a difference. And you guys know that, have witnessed that and have seen that in terms of your work with families and kiddos. And we can really improve the outcomes of children whose lives have been impacted by the experience of out-of-home care and adoption. The NTI training, we've got to say that over and over again because we want you to take a look at it, embraces the work of numerous experts in the field who have dedicated their careers to better understand how we can improve the outcomes of children whose lives have been impacted by these experiences. I love this statement, it shouldn't hurt to be a child. So go ahead, Lisa, we can keep it on push. So let's talk just a minute about what we feel and what the research has stated that mental health professionals should know. And I want you to put in the chat too, what you think mental health professionals should know as they're working with adoptive and foster and guardianship families. We definitely know that they should understand the psychological impact on adoption on children and families, which is key. We do understand that loss is a core issue in adoption and how children process loss at different stages of development. Loss is one of those core things in adoption and foster care. Understanding the impact of trauma and how serious problems can result from that, and the role and impact of attachment on the mind and body of the developing child, because that does have a deep impact. There's stuff in the chat box, Lisa, that I may be missing. There's a reference to specialized training. So many, the complex relationship and helping families find ways to bond together. Someone mentioned play therapy. Yes, indeed. Play therapy is certainly one of those tools in our toolbox. What else, Lisa?
BCIT, the complex relationship and helping families find ways to bond together. Yeah, play therapy is mentioned. Also, adults are the models for behavior. It matters how we act and react around them in all aspects. Therapists, mental health and child welfare professionals alike, I would say, need to listen. They're not the experts unless they've been in their shoes. Let's see. They should also look at the way the child reacts to other children and the teacher for attachment issues.
Yes, absolutely. Absolutely. These are all very, very good. And thank you so much for sharing those and reinforcing the need for what mental health professionals should know.
It also said, oh, I'm sorry.
Oh, go ahead.
It says, Richard says, caregivers should be cognizant of the fact that their past experiences with their children will differ greatly from a foster child, given the foster child's previous relationships. So parenting, perhaps parenting a child that you've taken in foster care is going to be different than a child that you raised from birth.
Yeah, absolutely. Absolutely. Great, good stuff. So we often talk about, when we talk about mental health professionals, we also encourage parents to interview prospective professionals, not only parents, but also you as professionals, if you're going to be doing any type of referrals or you're building your network of mental health professionals in your practice. So here are some questions you might want to pose as well, or consider posing to those professionals. Experience, how long you've been in practice, your degrees or certification. Do you include the entire family or work with children in therapy? Have you taken any courses or training in adoption competency? Your approaches to therapy. What else might you ask a therapist you're considering to work with your family, with the family that or kiddos that you're working with? Put those in the chat as well. This is just a sampling, and we have a whole laundry list of key questions that you may want to consider when you're interviewing a potential therapist. It's so important to ask some of these questions because we sometimes take for granted that a particular therapist has knowledge and experience in terms of working with families and kids in adoption and foster situations.
Yeah,
So
I
we,
like this consistency. Will they be able to work with a child for a longer period of time? That's important because this doesn't happen overnight, right?
absolutely,
Cultural
absolutely.
competency. Yep. We have somebody who can talk about that competency with our families. Maybe does the family have access to therapists or professionals who sort of match, if you will, whether it's being a person of color or male or
Mhm.
female, or somebody who has, SOGI issues.
Yeah,
We want to make sure that we're attending to those and not just finding just somebody, right?
absolutely. Lots of considerations, absolutely, and those are very good uh, considerations and questions and things that folks might want to consider. Next slide, Lisa. And what we believe are some of the core messages in terms of not only NTI, but what mental health professionals should have a critical role in. They should be helping children tell and understand their stories, right? Because there's so many stories to be told and so many things that kids are seeking to understand about their life experiences. Parents, helping parents to understand the impact of grief, loss, and trauma. So core. Parents also will need to reframe their children's needs because they'll see so many manifestations, behaviors, and otherwise, and reactions from kids in adoption and foster and guardianship. And professionals should really help parents honor and maintain connections, which is key as well. So many considerations for mental health providers, but I think it's so important that we really take a close look, ask those questions of ourselves and of other professionals that will be working with our families. Next slide. So we believe that mental health professionals can learn new tools, right? We can always add new tools to our toolbox to support hope and healing. It does not require use of a new model. We do a lot of sort of focus on neurobiology and the ACEs. Lisa and I have been doing several presentations around therapeutic parenting strategies that differentiate between can't versus won't behaviors. And it's so important to really understand the big picture when we work with kiddos and families. So we believe that these key messages are truly core, and we truly built it into the NTI training at many, many levels. So, we're going to breathe and wrap it up. Lisa, by the way, is a yoga professional, and we're always doing stretches and doing all kinds of things to keep calm, deep breathing exercises, etc. So we're going to wrap this up. Again, thank you so much for your time. So Lisa, put a bow on it.
Yeah, so just wanting to thank you, Edna. And yeah, maybe take a deep breath. There's a whole lot of information here. There's a lot of really great and very heartfelt sharing, and we really, really appreciate that. Telling personal stories often helps us to have a better understanding of the work that we're doing. And, NTI, again, it's web-based, it's self-paced, it's free. It's so rich with so many resources. We really would encourage you to take a look at it. It's free. It's free. We keep saying it's free. There are CEUs, free CEUs attached to the NTI training. It can be accessed on our website. And if you want to put that in the chat box again, we'll put that in there. And actually, I'll put our contact information up as well. Lots of great resources, lots of tools, lots of things to talk with other professionals about. NTI has really been developed to create a shared language between child welfare and mental health professionals, and then just totally packed with tools for professionals to use with families. As soon as you start the training, you could start using all of the materials that are embedded in the training itself. We want to again say thank you very much. And if there are any questions, we're happy to answer those questions now. And so maybe Kelly, if you were keeping track of questions or maybe comments that we missed, with a lot of people, it's sometimes tough to keep up with the comments.
Yeah.
Sure.
Yeah.
I
And
was
I
just
want to
gonna
say, we are really interested in reaching out to mental health professionals. We work with child welfare professionals, child welfare supervisors, but we also know the importance of adoption competent therapists. So we really, really would love to hear from you, and we're happy to connect and talk to your team because we know those connections are important. And it was
Lisa,
our pleasure. I'm sorry, I'll zip it.
No, that's okay. I just wanted to say I did not see any Q&A, but I'm sorry, any questions, but I am looking, just browsing through the chat really quick. Well, I will say that everyone really seemed to enjoy the presentation. It was great. You two are an awesome team. I would like to also say to the participants, please fill out the survey as you are exiting the presentation and share your thoughts about today's presentation. Lisa and Edna, I did not see any questions. You want to go ahead and close?
Okay.
Okay.
Well, thank you
All
very
right.
much. And again, here's our contact information. Edna and I are really helping folks all across the country to implement NTI, either on a one-to-one basis or in an agency, mental health clinics across the country. And as Edna mentioned, we are really interested in expanding in mental health across the country for sure. So reach out to us. We're happy to talk with you and help you figure out how to implement in your area.
Yes, indeed. Thank you so much for your time today. I really appreciate it.
Thank you everyone for joining us. And I would like to give SAMHSA special thanks for allowing us to share this presentation with you today. Enjoy the rest of your afternoon. Take care, everyone.